My name is Yashil and I'm 34 years old, based out of Gurgaon in India. And I recently got operated for mouth cancer. So today is my 11th day after surgery, and this mouth cancer was developed because of a sharp tooth. So, so very surprisingly, people relate mouth cancer to smoking or tobacco chewing or alcohol. However, I was not into any of these things, but still I unfortunately developed mouth cancer because it was a sharp tooth which was hitting the base of my tongue, and initially it was a sort of pimple which developed into ulcer, and since it was left untreated, it turned into cancer. So I had to get my tongue removed as part of the operation, and then I also had neck dissection, wherein they removed a few of my lymph nodes to check if the cancer has spread to the lymph nodes as well. So unfortunately, fortunately, it had not. Now, the point I'm trying to make here is like, the mistake that I made during all these months when I had developed that ulcer was that, I kept going to skin specialists. And since I never knew the reason of that ulcer and it was not healing, I kept going to skin specialists, and they kept giving me some ointments which never worked. And until very recently, a month back, I went to a dentist, and she was quick enough to figure out that this ulcer is because of a sharp tooth which kept hitting the base of my tongue, and and then that's the reason it was never healing. So so though she smoothed the sharp edges of my tooth, but then I guess it was too late. The cancer was already there. Then she advised me to get the biopsy done, and it turned out to be a poorly differentiated squamous cell carcinoma. Uh, and then, I underwent the surgery, and I was told that my speech I would be able to recover in 2 weeks. However, I don't think so. I'm anywhere close to that. It's been 11 days. My A portion of my mouth, which is the left portion of my mouth and face, it has gone numb. Maybe that is the reason I'm not able to open my mouth properly. There are stitches on my tongue. My I'm not able to roll my tongue properly, and it requires a lot of effort for me to move my tongue from one side to the other, or even to move it out. Uh, but I'm glad that I'm at least able to speak and communicate my feelings. So the highlight of for this video I'm trying to say is like, if you have a non-healing ulcer, uh, try not to go to skin specialists or ENTs, because you'll get all sorts of advice around that. So first go to your dentist, and then just make sure that it's not your tooth which is actually keeping the ulcers there. It's try and rule out that possibility first. So yeah, so after surgery, I what I noticed was that I was having my food through a pipe which was going through my nose, and then there was also a tube which was coming out of my my neck. They said that the lymph nodes which got removed, they might be kind of bleeding, and then all that blood was coming down through that tube. Uh, and post surgery, even till today, I feel that my shoulders have gone heavier. It's a little bit difficult to move my shoulders. Uh, Doctors say that maybe it's because you've not been working out for all this while. They've gone stiff. I hope that's the reason, because that's a temporary reason. I hope this is not something very permanent. So thank you, and all the best if you are currently currently having an ulcer, try and get it treated ASAP.